So, to get started, I will need to go down a list of some different symptoms, okay? It shouldn't take too long, and then we'll get on with it. So, have you been experiencing any chills, fatigue, fever, weight gain or weight loss? Okay. How about hearing loss, sinus pressure, or visual changes? Okay. Any cough, shortness of breath, or wheezing? Any chest pain, pain while walking, edema, or palpitations? How about abdominal pain, blood in stool, constipation, diarrhea, heartburn, loss of appetite, nausea or vomiting? Okay. Any painful urination, excessive amount or urinary frequency changes? Alright. Cold intolerance, heat intolerance, excessive thirst or hunger? Right. Dizziness, extremity numbness, like in your arms or legs, extremity weakness, headaches, seizures, tremors? Headaches, okay. Any anxiety or depression? How about hives, mole changes, rash, skin lesion? Rash, yes, I can see that. And hives. I'm going to include skin lesion too, but we'll take a closer look. Back pain, joint swelling or neck pain. Some back pain. Do you bleed or bruise easily? Any lymphedema or issues with blood clots? Okay. And then any food allergies or seasonal allergies? Seasonal? Okay. Yeah. Pollen and Scotch broom. Is it Scotch broom or Scotch bloom? Broom? Okay. Alright. But no known food allergies? Any medication allergies that you know of? Okay. This is actually an invasive species here, and we're supposed to recall and report it if we see it anywhere. So we have headaches, hives, rash, and possible lesions. Okay. So, this is a clean surface here, so please, if you don't mind, placing your arm on the table here so I can take a look. Okay, so, yeah, just off the bat I do see that we do have some hives forming and some very inflamed skin present. Okay. I'm gonna very gently rotate your arm, okay? What's under this bandage? A cut? Okay. Yeah, we definitely have some angry, red, inflamed skin here. I'm gonna very lightly touch just so I can check the temperature, okay? Is this tender? Okay, I'm sorry. I'm just gonna take a quick skin temp. You can relax your arm. And actually, you don't need to have it pulled quite so far forward. Sorry about that. Okay. I'm not seeing any elevated temps that might indicate the presence of an infection, but that doesn't completely rule it out. So one thing I want to do really quickly is I'm going to draw a margin of where the rash is presently stopping, just to rule out something like cellulitis. And if the rash does spread upon that point, then we're going to take some blood cultures. But to start, I'm just going to mark it like that. Okay. And this is not the best pen here for doing this. Alright, and then I'm going to lightly rotate again. Okay. This to me looks like an allergic reaction, but I would like to take a culture and run it for bacteria as well as fungal, just in case. Have you noticed any kind of drainage or weeping coming from the rash anywhere? Okay. I'm going to irritate it just a little bit, okay? Just so that way I can have something to swab. So. Okay. Have you used any kind of new products at all, such as like a new lotion, any kind of new perfumes, bath gels, soaps, even laundry detergents or fabric softeners? Okay. You have a new laundry detergent? Okay. And are you seeing this rash anywhere else? Okay. Yeah, it looks like the hand is spared. Have you ever had a rash like this before? Okay. Well, I think what I'd like to do is do an allergy test with you, just to rule out an allergic reaction to some of the common allergens that are present in laundry detergent, and also some that are present in moisturizers as well as different body washes. Let's see what comes up. Okay? Okay, I'm gonna get this ready. Okay. So I have these drawn up, so I'm just gonna place them so that they are in order. Two, 7, 9, and 10. I'm going to go ahead and clean the area. I'm going to use a different pen, since this one has proven itself to not be friendly for skin. Okay. So, 1, 2, 3, 4, and 5. 7, 8, 9, 10. Okay. So, to begin, I just want to reassure you, okay, because I know some people are not the most comfortable when it comes to needles. These are very, very thin. So, you'll see, it's like almost as thin as a hair. So you shouldn't feel too much other than a little bit of pressure with the injection, okay? Okay. So, if you're ready, I'm going to begin. Okay? And I'm going to go right here to start, like so. Is that okay? Good. Okay. So then we're going to do our next one here. So go right here. Good. You're doing great. Okay. Now we're on number 3. Still looking good. I'm not seeing any new inflammation. Now we're on 4. And 5. All right. Still looking good. Just checking every time to make sure we don't have any kind of immediate reaction, because that could require us to grab some adrenaline, which I do have right behind me, so don't worry. And just trying to make sure the bore of the needle is facing up, which it is. All right. Good. Okay. Doing great. Last one, okay? number 10. So now we're going to give this 5 minutes, okay? So you can just relax. Time's up, and it looks like we do have an allergic reaction here. Excuse me, to number 8. How are you feeling? Are you having any kind of difficulty breathing? Okay. Is this painful? Just a bit itchy? Okay. So, let me just look here. Number 8 is benzothiazolinone, which is a preservative commonly found in laundry detergent. So, we guessed right there. So, okay. In just a few moments, I'm going to have one of my nurses come in and administer an antihistamine. And we're also going to keep you here under observation just in case anything else here turns positive. All right? But from here on, it's going to be very important that you switch to a hypoallergenic detergent. And it may be a good idea as well to rinse your clothes more than once, just to make sure that any detergent lingering on your clothing or your linens is completely rinsed off. But that is a common allergen, so if you do get a hypoallergenic, detergent, sorry, then that should eliminate the issue. And you're having an okay time, you're still having an okay time breathing. Okay, really quickly. Just want to make sure of that, okay? So I'm just going to have you open your mouth for me, okay? Thank you. Okay. Yeah, I'm not seeing any swelling, so that's good. So, okay. Okay. So now one thing that will be important is because sometimes all of us stay in hotel rooms or stay somewhere else where we can't control our environment completely. It will be a good idea to let the hotel know in advance, for example, that you do have this allergy, okay? Usually they're able to accommodate, but sometimes that's not the case, in which case it may be ideal to bring your own bedding, if possible. We will write you a prescription for some epinephrine just in case you are exposed at some point in the future, because sometimes things are out of our hands. And so if in fact you do get exposed and you start experiencing this rash again, that medication will help. That being said, if initially you expect that you may have been exposed, a good idea would be to immediately take a Benadryl and wait and see. But sometimes we're not always aware of things right away, so in which case the epinephrine will come in handy. Yes, it is an EpiPen. And then if you're staying at a friend's or at family or what have you, Airbnb, definitely a good idea to bring your own bedding if and when possible. Okay, same with towels, but usually same with towels if possible. Do you have any questions for me before I step out? Okay. We'll probably keep you here for about 2 or 3 hours just to completely eliminate the possibility of any kind of more severe reaction that may be delayed. And we're also going to be coming in and out of here to kind of check and make sure that there are no new reactions to the tests administered. Sometimes that happens, though uncommon. And also, I will be running your specimen here stat. So if anything alarming pops up, we will also be performing some blood testing to make sure that this is not infectious in nature, okay? Okay. So in the meantime, I'm going to go let my nurse know to come in here with some medication, and she will discuss with you any kind of side effects and what to expect, okay? In the meantime, I do encourage you to keep your arm right here just to keep it from being jostled. We want to make sure that any reaction that does pop up is from the serums administered, not from having the arm irritated or jostled around, okay? Okay, so you sit tight here, okay? Okay.